Hello, everybody. I am super duper excited to have you all joining us here today at the Nursing in Style Podcast as we have our guest, Marvin Siegel, who's here to help us through accreditation and survey success. Accreditation is an area with surveys is an area that makes everybody nervous. When you say survey, everybody scramble. And I always say, why do people scramble when it's time for survey? Why not get excited about your surveyor that's coming? So our guest today is a registered nurse since 1975, brings a decade of leadership in critical care experience, home infusion experience, and specialty pharmacy. Served as the director of infusion for Visiting Nurse Society, one of 3 national nursing directors for a major home infusion organization, and DPS for a New York-based agency. Held 2 terms on the INS board and currently chair the CRNI Exam Council. Your national influence includes roles with NHIA education and standards committees, CHAP site visits, and NICA Stakeholder Review Council. You're a busy person. With a career spanning clinical excellence and industry leadership, I remain committed to advancing infusion nursing practice and standards. So welcome to the Nursing in Style Podcast, where we empower nurse entrepreneurs and agency owners and healthcare leaders with the knowledge they need to build compliant, high-quality organizations. And in today's episodes, we have an exceptional person, Marvin Siegel, here with us that's going to help us to go through the survey experience. We'll dive deep into the accreditation and survey success, common pitfalls, and even exploring the unique opportunities when serving as a surveyor. Get ready to take your notes and take on this masterclass about operational excellence. All right, so Marvin, let's start a little bit about your background and experience with accreditation and surveys. Like, how did you get involved with accreditation and surveys?
Well, first off, Danielle, thank you very much for inviting me to be on your podcast. I am privileged and honored after getting to know you that you've asked me to be here. And I'm more than happy to share any little bit of information that I can. I became a surveyor in 2020. I had retired from full-time nursing, and a approved accreditation organization had reached out to me and asked me if I wanted to do home infusion surveys. And I said yes. And then a few years later had asked if I wanted to add home care or non-Medicare surveys to that. And I said, yes, I would do that. And so for several years now, I've been doing the home infusion and home care surveys. And it was just a matter of having contacts within the industry, having gone through the survey process myself, and just staying in touch with people. And that's what I've done in my entire career, because you never know when someone may need you to help them or that you may need them to help you. And it was just my fortune that there was a need at an accreditation organization, and I was able to help them to do that. And so I was very happy to do that.
I love it because you're always traveling about the world. It's like, where is Marvin this week, right? You never know what state you're in, where you are, meeting so many amazing home health owners as you travel. I love it. What is one of the true values, would you say, of accreditation? Because it's always the question, should I get accredited or not accredited as it relates to home health agencies and home care agencies? What do you believe the accreditation value is?
The first value should be good patient care, quality care. There are some states that there's a requirement that you have an approved accreditation organization through one of several. And approved is simply the accreditation organizations that are on the CMS list of organizations. So if you are in a state that requires it, then you have choices to make. But if you are in a state that does not require it, And I commend those organizations that do go through the process. And it is a testament to them and their dedication to quality care, to patient care, and also to continual growth of their staff through staff training and education, and putting out a good quality product and putting out good care in the home. And that's the most important thing. That's what we look for. That's what a true site surveyor should look for, is not just are you meeting regulatory needs, but how's your patient outcomes? And having an accreditation, as I said, that's an example to people looking for an agency to take care of their loved ones. That's an example for organizations looking to network with or contract with home care organizations. Are you accredited, or did you take that time and effort to do that? And the bottom line should be good quality patient care. That should be the be all and end all. And then you go through how you're going to do it once you have your accreditation. And we'll go delve more into that as you ask me more questions.
Yes, love it, love it. Let's talk a little bit about the myths and misunderstandings that agencies owners have about accreditation. I know one of the myths is you're just paying the price tag. It don't do nothing extra. But what's one of the myths that you've heard? I mean, I've heard it all.
Same thing, that it's not worth my time. It's not worth the effort of my staff. My staff is too busy to get involved with this. But I have to do it because of either state regulations. I have to do it if I want to get certain insurance contracts for billing purposes, but it doesn't bring any value to me. It takes time away from my resources. It takes time away from my staff, and it's just busy work. And it's my role when I go in to show them that's just not true. That is kind of stifling the experience, and that's not thinking ahead. Thinking if you play the short game and you're saying, oh, it's going to cost X amount of dollars, we have to devote these hours to it. My staff is got to be taking, intake and referrals and doing assessments. They don't have time for this. You're not thinking ahead. If you're going to play the long game and you want to build your organization and you want to build it based on quality, then you should say, let me welcome this accreditation process. Let me show people that are looking to me to take care of their loved ones, their family members. Let me show these insurance companies, let me show these regulatory bodies, I'm willing to take the time and the effort because I want to be here for a long time and I want to know I'm doing things right. And so I'm willing to have an independent outside organization come in and validate what I do. Because if you just do a self-study, you just do your own valuation, everything's going to be perfect. But you're telling people who are looking to you, hey, look, I not only had somebody from the outside came in and validate me, I paid them to come here and do it. That's how much confidence I have that I'm the right person, I'm the right organization. I've got the right staff to take care of your patients, to take care of your family members. I am confident in my ability to do so. And
Yes.
it just shows them. So the mindset has got to be on the long-term game, not on the short game, where how many quick referrals can I get? How many, patients can I get on board? I want to be here and I want to continue to do this and I want to do it in a quality manner. It would be like building a house on a foundation of straw, which you could do real fast, but then when the first wind or rain comes along,
Right.
it's washed away. But you want to do it the right way. You want to
Yes.
take the time to pour the foundation, to make it solid, and then build level upon level upon level because the foundation is strong. And that's what you should do.
So, see, going the accreditation route is a level of quality, a level of standard, a level of basically saying, putting a stamp of approval on this thing, that you're going to be willing to take those extra steps, be willing to have that expert come in to make sure that you are able to give out this quality care because your policies and procedures and your processes line up. I
Exactly.
like it.
Yeah. If I could just add to that,
Yes.
recently, this past September, in the Home Healthcare Services Quarterly Journal,
Mhm.
there was a study that CMS did of almost 8,000 agencies across the country. And they found that the organizations that went through the time and effort for accreditation scored the highest in three quality indicators that CMS and insurers and referral sources look for,
Hmm.
which was a timely initiation of services in the home, which was a preventing rehospitalizations for the same situation that put somebody in a hospital and they was sent home, and a massive prevention in unscheduled emergency room visits. And as those of us in home health know, the whole goal of home health is get you out of the hospital as soon as you can and
Hmm.
keep you home where you're going to recover and you're going to get better and you're not going to go back and what situation or what illness you have, it's not going to progress at home. So this independent study showed that the organizations that did have the accreditation in those three areas were markedly better than organizations that did not have accreditation.
See that? Another stamp of approval, another level. Yes. So, for owners that are preparing for their very first survey,
Mhm.
what can they expect from this process? And let's separate it. So, let's talk about an owner that's going through their first survey that is a home health, skilled home health owner. And then
Mhm.
we'll do home care owner since you have both of those sides.
Okay.
So, skilled home health or home infusion owner, what should they expect for their first survey?
Well, for any accreditation organization that you're with, you're going to get a copy of their standards.
That's right.
You should look at those standards before the surveyor shows up because those standards are going to be your blueprint of your policy and procedure manual of what policies you need to be in place. And those policies are everything from patient care to management and governance, infection control, your emergency plan, your QAPI or your quality assurance and performance improvement plan, your compliance plan, and your staff education, training, and competency assessment programs. So if you look through those standards, it kind of gives you a clue to where you should be, especially if this is your initial survey and you or your management team, no one has been through a survey before. You kind of don't know what to expect, but you
Mhm.
do have a blueprint. So you should start looking at that, getting yourself ready, making sure that your policies and procedures are in alignment with the intent of the standards. Um, the standards usually you don't have to go word for word with what the standard has, but you look at what the intent is,
Mhm.
and the intent should once again be excellence in patient care and also a guarantee that your staff, before they even touch the first patient, has been evaluated for their competency, their training, if they need any more training, their experience and their expertise. So you send the right nurse to the right patient,
Mhm.
and you will know what's going on there by you look at your referrals and say, this patient is coming home on this piece of equipment. And I know that Danielle has got documented experience and competency, and maybe Marvin doesn't. So we're not going to send Marvin in, we're going to send Danielle in. You want to match the right nurse with the right patient based on their therapies. And so just by reading the standards, it's going to give you a good idea of where you should be and where you should be prepared before the surveyor shows up.
Mhm. Yeah, I like that. Now let's go into home care. Is it any different?
The difference in home care is you will have, depending upon the focus of the organization, some will do skilled and non skilled care, some will only do non skilled care. In that case, you need to be sure that your home health aides, whether they're certified nurses aides, whether they're home care aides, whether they're personal care attendants, and different organizations in different states have different definitions. But in the same manner, you will need to know, what is their training, that you've assessed them for their skill level, you've trained them if necessary, or you've obtained documentation from them and you validate that maybe they've been trained by another organization. So they may not have to go through the entire training program.
Mhm.
Say, for example, to use a Hoyer lift.
Yeah.
You send a home health aide in to take care of a patient, and they say, yes, I've been trained on the use of a Hoyer lift. Here is my document from where I've been trained. And you will just have to assess them in a skills lab as opposed to them saying, I've never used a Hoyer lift before. And you go, okay, well, now we've got to train you on it. We've got to document the training, and then we have to test you on it. So it all depends on their level and their experience, but it is still your responsibility when you're sending, even if it's a non-licensed, non-skilled staff member, they still have to be competent in whatever you expect them to do, whether it's assist with tube feedings, whether it's assist with a client using a walker, getting out of the bed. It is your responsibility, once again, that you're going to guarantee patient or client safety and good quality care by sending in the right person for the right task.
Mhm. Now, you gave some really, really good nuggets. You basically said, look, make sure the people that you're assigning out there, you can show those competencies. So that's one of your first level. Whoever
Exactly.
you're hiring, whatever active patients you have, you should have evidence that those people that are serving those clients have competencies in the area. So that was a really, really good nugget. Um, you know, I had the privilege of going through many surveys as an owner and as a director of nursing outside of my ownership. And some of the first levels that people miss when a surveyor comes. So when a surveyor comes and you're walking up to the agency, what is the first thing you're expecting to see on the door?
The hours of operation and a phone number to reach for after hours.
Yeah,
And you would be surprised how many organizations do not have that on their door.
that's right.
I have arrived at surveys and nobody was there. The door was dark and the lights were out.
Yeah.
And I had to actually call my organization and say that I was told they open at 9. I'm here at 9:20. There was nobody here. There was no phone number on the door.
Mm-hmm.
And that's not a good start. That's not a good first impression. Whether it's for me or if I'm coming to you because I need a loved one or family member to be taken care of, it's like going to a restaurant for dinner and it's dark and there's no one to call. You don't know hours of operation. You're not going to go back to that place.
Right.
That information should all be there.
Yeah. What happens when it's in a home office? I'm sure you've gone to some agencies that's operating out of the home office.
I certainly have.
Mm-hmm.
Several of them have been new startup agencies.
Mm-hmm.
They just don't have the resources to pay rent on a building
Mm-hmm.
because it's rent, it's electricity, it's heat, it's staffing the office, manning it, and etc. So they would designate an area in their home.
Mm-hmm.
Once again, you need to check with your state regulatory body,
Mm-hmm.
but primarily it has got to be a separate entrance, not going through your home. It has to have a room or an area where you can have a confidential conversation with a family member, with a nurse, with an aide, with a patient who may come in where you're protecting their HIPAA rights, and you have to have the ability to store files in a safe, confidential, and HIPAA protected area, which could be just a locked file cabinet, and so people can certainly do that. There's no regulations against having a home office, but there are regulations on what surrounds it. And primarily it's protecting privacy and protecting patient records and client confidential information.
Yeah. And we still have to know when you're open.
Oh, same
The
thing.
hours. Still have to have that posting.
If the entrance is through, say, a side door or the backyard and you've got a porch, it has to have, the name of the organization, the hours of operation, and the phone number to reach and how to contact them after hours in case of emergency.
Outstanding. Look at that. Another amazing nugget, because believe it or not, as a consultant, I've had people get deficiencies on that area. I'm like, that's rule number one. Like, we got to know that you're open.
It's a business.
Right. So let's talk about what are early indicators. What early indicators help surveyors determine readiness? What are some of the early indicators where you know that this person's ready?
Well, once again, whatever organization you're using for accreditation, they will give you your standards. and
Mhm.
all of them have a readiness or a self-survey workbook for you to work through. So when I get information from the organization I work for, and I'm going to go to Danielle's Home Care, I'll go on my company's website. I will get your address. I'll confirm it, the phone number, but there's an area that we call readiness, and I'll click on that, and it will say either 100% of the workbook has been done, which means you've gone through the standards, and some of them will ask you, if possible, to download information, download some policies, procedures, staffing information, scope of services, things like that, so I
Mhm.
can review them and save time before I arrive there.
Mhm.
And sometimes I will go into the readiness book and it will say 2% was done, 5% was done. Sometimes it'll say 0%, which means that the organization hasn't taken the time or the effort
Mhm.
to do that. And once again, that's a first impression that says either they didn't understand the importance of it, they were just too busy, they didn't have the staff. And I understand that. Some organizations that are, it's their initial survey, the owner is usually the director of nursing,
Mhm.
and he or she is working another full-time job before their agent, unless they've got some good financial backing. So they may need to continue their full-time job and still open the agency, and they don't have the resources to hire somebody else to see patients. So they're seeing patients, they're doing the opening, they're doing the assessment, they're answering the phone calls, they're getting ready. Maybe they have somebody working part-time. So I will find out from them.
Mhm.
And other times I will walk into an initial survey and it is in a formal office in a commercial building. There's a receptionist there, there's somebody there. And I'll say, I'm just curious, you've had, weeks in advance, why didn't you do any of the self-survey? And
Mhm.
they go, well, we figured you were going to be here and go through it, so we didn't need to waste our time going through it and then going through it with you. So then we have a conversation regarding, the process and how it benefits them. It doesn't benefit me. It
Mhm.
actually puts you at a disadvantage, because now you're going to start to get me all the required information that I need. And if you would have downloaded even half of the policies and procedures, I would have read them
Mhm.
before I even arrived on site. And I
Mhm.
would save us time for me sitting and reading a policy and reading procedure manuals. When if I would have done that, we could have focused more on patient care, or we could have focused on, I've read your policy on infection control, for example, and you're not in guidance or in sync with the current CDC guidelines on hand hygiene.
Mhm.
Or if you're an infusion agency and I'm
Mhm.
reading your policies and procedures and I'm going, you're not you're not up to date on the current infusion standards. And now we have to go, spending time doing that.
Mhm.
So I can, I'll sit there. If I'm there for 2 days, if I have to spend 8 hours sitting there just reading,
Mhm.
rather than working with you and helping you to improve a process, to update, to maybe give you the benefit of my experience and my background, and work with you and your staff, which is better for you, it's more beneficial. It's really, if I'm there for 2 days and one day, the majority of the day is just sitting, looking at me read a manual, it doesn't benefit you. So it is always advantageous to the organization to go through the self study before the surveyor arrives. That way they can come ready and be prepared to say, this is a little outdated. I couldn't find this policy. Help me, show me where it is. This one needs a little tweaking, things like that, and help and work with you collegially to improve your process.
Mm. Those were really good tips. So doing that self-study ahead of time, it prepares your surveyor. So the surveyor also knows what they're walking into. And now we can just get to the meat of what needs to get done and save some good time. So
Like
what documentation or operational issues do you see most frequently?
the ones that are problematic,
Yeah.
unless somebody has got a background in compliance and
Mm-hmm.
quality assurance,
Mm-hmm.
they don't, and they have not read or looked into the standards, they're not aware of what a true quality and performance improvement program is and how it really has to be patient care centered, how you have to have performance improvement goals and objectives that are really going to help you improve the performance of the organization, improve patient care, collecting data and analyzing data. And the most common problem I see is that organizations don't establish a performance threshold and expectation of performance. For example, they're going to do a personnel file audit of new hires,
Mm-hmm.
and they have, say, 5 new hires, and they've audited the records, and they showed that out of the 10 new people, 3 of them never had competency assessment checked. So that 70% have had it done, but 70% have, 30% haven't. And I say, well, what is your expectation? They go, what do you mean? I say, well, it shows 3 out of 10 of your new hires didn't have competency assessed. Is that good? Is that bad? Do you expect 90% of your people, when you do a chart or a personal record audit, or even a client or a patient care record audit, you
Mm-hmm.
have documents that you expect to be in there, consent
Mm-hmm.
forms, client bill of rights,
Mm-hmm.
financial information, and you just say out of 10, 3 did, 2 didn't, 5 didn't, but you don't have an expectation, a performance level. You should, with everything that you're going to measure, you need to establish where you want your performance to be. Do you want 90% compliance? Do you want 80% compliance? Are you expecting 100% compliance? Whatever it is, if you don't have a level of where you expect to be, you
Mm-hmm.
just have a group of numbers and you have data, but it's meaningless. So I
Yeah.
tell them, you can't just say 3 out of 10 were missing this, but that's okay because we only expected 50% compliance, or we would like 90%. So I tell them, anytime you measure something, you
Mm-hmm.
need to have a threshold that you're holding it against.
Yeah.
So that's an area that's a problem. And competency and skills assessment of any level of staff, licensed or non-licensed, they don't have that in there. And the last thing is a documented orientation checklist of what you've gone through with everybody. I see many organizations go through orientation, but they have no checklist. So when I look and did you do infection control? Did you do emergency play? Some of them do, some of them don't. But if you have an established checklist, then you know it's a template and everybody gets through it the same way.
Mm-hmm. I like that. That's levels of measurement. So if you don't set the bar, you don't know what a passing score is, right? So setting that bar lets us know when we're truly passing and when we're not. And then we'll have something to compare against this quarter versus last quarter, et cetera. So I like that tip that you just gave out. The checklist. I'm really notorious with teaching about that. It's so important to have that because
Yes.
that helps you to make sure you don't miss anything. And for the surveyor, it's no guessing game. You
Yes.
see what's there, right?
Mhm.
Now, if you
Exactly.
have one more question to see, okay, what does that teaching look like? What does the content look like when you say you went over infection control? Now we can show you what that means. So it sounds like the more the agency can prepare themselves by reviewing their regulations, the
Mhm.
standards, right, for the organization that they've chosen, that helps to prepare. Doing the checklist, going through the readiness, that helps them to know what they may be missing ahead of time. Because
Exactly.
I tell people all the time, surveys are not coming to your organization to necessarily fail you. That makes the surveyor have to work harder, to have to write up all these deficiencies. Like, please prepare, come together, get it together so that you can have a successful survey. So, how can we get owners to shift from surveying anxiety to survey success? As we get ready to part, just tell someone who's a brand new owner or someone who's gone through surveys in the past, had a couple of deficiencies, and they're getting ready to go through survey again. What are some of the things that they can do from the door to just make it better? Because the surveyor is there to support you in your success. To me, that's how I feel. But give me
Yes.
your take.
The first thing is mindset. Change your mindset. Like you said, a surveyor is not coming in or should not be coming in looking for problems.
Yeah.
The surveyor should come to you to validate how good you're providing for care for people, patients, non-skilled or skilled, ways to help you, ways to make sure that you are up to speed, that you are current, ways to make your operation flow smoother, more efficiently, have happy patients, happy clients, happy staff members. That we are there as a partner for you. Because if you are very tense and I just add to the tension,
Yeah.
Surveys and accreditation organizations, it's like if you go to one restaurant and you get bad service, you're not going to go back. So just because you start with one accreditation organization, if you have a very mean-spirited and uncooperative surveyor, no one is making you stay with that organization. You can go, forget this. This is terrible. This is bad. I got to go someplace else where they're going to help me. So, and also leadership should assign people to be responsible. You go through the workbook, you go through the readiness. You should have one key person. It could be your director of nursing, it could be your compliance manager. Have one key person in charge of the process, but then assign tasks to different people, have a timeline, and then hold them accountable for it. Not just say we need to do personnel file audits, we need to do clinical audits, we need to make sure our infection control policies are up to speed, we may need to make sure that our patient satisfaction surveys, and then everybody's thinking, I'm not doing that, I'm not doing that. And what happens when you don't assign people? Then the finger pointing. I thought Danielle was doing it. No, I thought Marvin was doing it. No, I thought Joe was doing it. Assign one person to be overall in charge. Assign people specific tasks with a timeline. Trust them to do their work. Don't micromanage them, because if you micromanage them, you might as well do it yourself. And have regular follow-ups leading up to your survey.
Yes.
Now, a CMS Medicare survey by CMS regulations is unannounced. So you don't know the day, but you have a window so where you're ready for it. If it is a home care, a non-Medicare organization, you will be told the survey will be there on these days. You have time to get ready and to be prepared. But like I said, for leadership, people will follow your example. If you're tense and you're oh my God, we're going to fail, they're going to close our doors, or and I've heard on my end when I was with different organizations, don't be nice to the surveyor. If they're nice,
I've heard that.
If they're nice to you, they're setting you up. They want to catch you. They want to trip you up. They want you to tell them something like, we didn't really get the patient's signature in that form. We copied it from another form because we knew you were going to be looking for a signature on the Bill of Rights. And they say the surveyor is not your friend. That's terrible. We're not there to become friends, but we're certainly not there to make enemies.
Right.
Be prepared, have an open mind, and knowing we have the same goal as you: good quality patient care, competent staff, a safe environment, and it flows smoothly. The best surveys I've done are the ones that are very boring to me because they're doing everything right. There's no correction needed. They're giving me the information that I need. They're providing me with the documents that I need. They're open door and they're letting me do what I need to do. And it's very smooth and it's very, very rewarding. But at times it's very boring because, God, you people are really good. You know what you're doing. So I'm validating that. And I leave there and I go, wow, that was easy.
Yeah. See, that's a compliment. That is a compliment. I always look at the surveyor as the person that's really, really coming there to help you to be successful, right? So I know I've watched surveyors. It's almost the pain is like if you don't have something that we want you to have that level of success. So read your standards in advance. Read your state regulations in advance. Prepare your teams. Train. Document your training. Assign someone that's going to be in charge of either this section or that section. Know who's the point person for your survey. have a survey checklist ready to go. So when a surveyor comes in, we know what the policies and procedures are to hand over to the surveyor. We know the area where we're going to have our surveyor to come sit and be comfortable to go through the steps. So it is an opportunity, as you said, Marvin, to see how well your agency delivers care. Your
Exactly.
surveyor is not in there necessarily, quote unquote, because everybody have different personalities, etc. But we're not coming there to attack you. We want to see you have a level of success. But we also are here as a responsible party to make sure that this organization is delivering safe and effective care in the community. And so that's what I love. So Marvin, as we close out, if there was one person that has passed away now, whether it's famous or someone that you know personally, who's the one person that you wish you could have a conversation with, and what would that be about?
I think, and I've thought about this, I would have liked to have a sit down with Albert Schweitzer for how he changed healthcare in other nations and how he led the concern about the care for people and the medical care and the education in the era that he lived and what he was able to do. He was someone that I would like to have sit down and have a cup of coffee with and talk about taking care of people and helping people.
I love it. Marvin, you are a true nurse to your heart. I mean, from the day I met you, you've always cared about nurses being at their absolute best, that they have the information, the understanding, being that head to give that education. How can people find you? Where can we follow you?
I'm on LinkedIn. I'm right out there. Just type my name in there. I don't think there are two Marvin Siegels out there. Just hit me up on LinkedIn. And if you want to mention, I saw you on Danielle's podcast, because sometimes you get requests for connections. And I go, I don't know who this person is. They're in a weird business, got nothing to do with healthcare, and they're just trying to grow their network. And, but definitely say, I saw you on the podcast and I may have questions. I'm an open book. I love, as most nurses do, I love to share information. To me, that's what I love about my job is I go in and I can share. I could see how nurses across the country do things in different regions. There are different customs and cultures, but at the bottom line is there's professional standards of care that we all have to follow. You may tweak it a little bit. You may do it a little bit differently. But I love sharing, and I learned so much because you can't be exposed to everything where you live, even in like, as because we met through Infusion. There's so much going on. There's in Infusion so much going on in home care, different needs, different parts of the country, and I learn as much as I help other people, and it makes me better as a person, better as a nurse, and better in my job.
I love it. Well, thank you so much for being a guest on the Nursing in Style podcast.
It was my pleasure, my honor.
Fantastic. You all have a fantastic evening. Bye-bye, everybody.
Bye-bye now.